pleasant good day, everyone, and welcome to the live press conference on the COVID-19 vaccine for St. Lucia. I am your host, Fernell Neptune. Today we have with us the panel. We have the Medical Officer of Health, Dr. Glensford Joseph, and also the Assistant Principal Nursing Officer, Tecla Baptiste. Welcome, everyone. First, we will start off with Nurse Baptiste, who will give us an overview of the National Immunization Program and also the value of the introduction of the COVID-19 vaccine in our program in St. Lucia.
Thank you, Ms. Neptune. Good morning, viewers. So St. Lucia's immunization program commenced in 1977. So our program is about 42 years old. Since the implementation of the immunization program, it has yielded numerous successes. St. Lucia have recorded increases in vaccination coverage since the establishment of the program from approximately 40% in the 1980s, shortly after it commenced, to 80% in the 1990s, and 90% and above in the 2000s. We have seen elimination of diseases such as measles, rubella, polio. Since the implementation of vaccine strategies, St. Lucia first saw a decline in the incidence of vaccine-preventable diseases. There have been no reported cases of measles since 1990, and we saw our last case of rubella in 1996. The program has also seen introduction of new vaccines into its program. And as for maintaining a coverage that is recommended by the Pan-American Health Organization, over the past 10 years, the immunization program has maintained the coverage for its infants under 1 year old of approximately 90 to 99%. Access to vaccines is a critical component, especially as it relates to universal health coverage. We know that vaccines fosters a strong and a resilient primary health care system. In St. Lucia, essential vaccines are easily accessible in all our healthcare facilities and for all. Vaccines offered in our national program provides protection against numerous diseases, including diphtheria, pertussis, tetanus, Haemophilus influenza, hepatitis B, measles, mumps, rubella, seasonal influenza, and also the human papilloma virus. Our program is executed at the various wellness centers across the length and breadth of the island, as well as private sector pediatricians and also the public health hospital, the private hospital, sorry. Our services can be accessed by various target groups through a range of delivery options, namely facility-based vaccination, house-to-house. There's a school-based vaccination program, and we also conduct community outreaches. Our services can be accessed by various target groups. In order to maintain a status of elimination of those diseases, countries are urged to maintain high population immunity of 95% and above in all health regions, whilst we continue to surveil, we continue to strengthen our surveillance, and that is important. Why? Because it is required for timely detection and management of cases and outbreaks of those vaccine-preventable diseases. Our program, of course, is continually assessed for gaps, and measures are often put in place to address any gaps that are identified, especially as it relates to vaccine coverage and the processes involved in the program. It is very important that the immunization program continues to engage and to remain committed to maintaining high vaccination rates to protect our population. As it relates to the safety gap of vaccines and in the program, are often put in place. St. Lucia to vaccination relies on the World Health Organization pre-qualification program to ensure the safety and efficacy of vaccines. We do have a vaccine surveillance system in place, and the role of this surveillance is to facilitate early detection, investigation, and analysis of any adverse events that may occur. And it's important to do so in order to ensure appropriate and rapid response. Adverse events are monitored by the Department of Health and Wellness. It must be noted that routinely before vaccination of any type, the nurse must provide information to the client about the vaccine. The nurse must tell the client what to expect after immunization and what should be done. Even at the point of vaccination, the nurse must brief the client on what type of adverse events to expect and what to do if they occur. In the event an adverse event occurs, it must be reported. First of all, it has to be detected and reported. Once reported, either by the client, a family member, or the nurse, once it is reported, it is investigated. And of course, after reporting, an investigation and a causality assessment is done. And finally, the findings of the investigation is normally provided as feedback to all relevant persons in the program. That is from the client to the national level. We have not seen any cases of severe adverse reactions or events relating to immunization. However, if in case one of those adverse events were to occur, our wellness centers are equipped with the necessary antidotes and the necessary equipments and to manage any adverse events that may occur. Our purpose here today is really to speak about the introduction of the COVID-19 vaccine and how important it is to the national response to the epidemic. But it is important that we put things into perspective and let our nation, let our people know what the immunization program entails, as I would have just done. But as it relates to COVID-19, we know that COVID-19 have had serious life-threatening complications. We've seen the devastating effects globally. And we do not know how COVID-19 is going to affect us. So when someone gets sick, they can spread the disease to family, friends, and others around them. And of course, this is our concern. The program, our COVID-19 vaccine program, which we are about to roll out, is going to be rolled out through a phased approach, with the first phase focusing mainly on people who are greatest risk of COVID-19. This shall assist us in protecting those persons with greatest vulnerability and likely those who would have more adverse outcomes if they get infected by the virus. It is important that we protect our frontliners, and hence the reason why they are part of our priority groups, because they are most high at risk. Our frontliners such as our healthcare professionals, firemen, and policemen, they are at high risk of exposure. They continue to be on the front line of the nation's fight against the pandemic, and it is important that they get protected. By providing critical care to those who are or might be infected with the virus, they put themselves at being at high risk of getting exposed to or even getting sick with COVID-19. So hence the reason why it is very important that they they receive their vaccines and to ensure protection. As it relates to immunity, we know that current evidence suggests that when someone gets infected with COVID-19, they would get a certain level of immunity. However, we're not sure how long that protection would last, and hence the reason why the COVID-19 vaccine, it would help protect us by creating antibodies, by boosting our immune system, so that we are able to respond without having to experience sickness. Yeah, so that's about it as it relates to.
Thank you very much, Nurse Tecla Baptiste. Right now we'll call on Dr. Glensford Joseph to speak on the overview of the rollout of the program. Also, he'll speak on the international support from the international public health partners for the introduction of this vaccine to St. Lucia.
Thank you, Ms. Fresnel. Thank you, Nurse Baptiste, for such a brilliant introduction into the whole COVID-19 vaccination program. You would have seen from the information provided by Nurse Baptiste that vaccines are very important. Vaccines have been around for decades. Vaccines have brought control to several pandemics that have been ravaging the world. And in our lifetime, we have recognized that we have COVID-19 to deal with. Just before I give you an overview of our rollout, just a quick reminder that as of the 7th of February, St. Lucia would have had 1,091 active cases, of which 2 are currently managed in critical care. We would have recorded to date 19 fatalities, many of whom would have had some form of chronic non-communicable diseases. And also, altogether, St. Lucia would have recorded 2,027 cases. We have seen the impact of COVID-19 on St. Lucia from the medical aspect, where it caused sicknesses and death, but also we have seen the impact on the economy from a personal level right up to the national level. As such, it is important and imperative on us to ensure, one, that we continue to practice the protocols that have been established to reduce the spread of COVID-19. Nurse would have indicated that persons who are ill do transmit the virus. But we need to understand also, just to add, that there are persons who become infected may not show symptoms and transmit the virus. More so, since COVID-19 is an evolving, emerging infectious disease, some persons who may not display illness at this point may very well have complications in time to come, as this has been shown in some of the developed countries. This being said, it's just really to lay the foundation why COVID-19 vaccine is important. We have seen the rollout of COVID-19 vaccine across the globe, and St. Lucia is preparing for its rollout. We have also heard of many conspiracies surrounding COVID-19 vaccines. But what we do know from the science is that the benefit of having the vaccine outweighs the risk. St. Lucia would have put together the COVID-19 Vaccine Technical Working Committee, that is an offspring of the National Vaccine Technical Committee. And this group has been working tirelessly to ensure that St. Lucia is prepared for a successful rollout of the vaccine. The team would have put together a vaccination deployment plan, and to be more specific, the COVID-19 vaccination deployment plan, after conducting an assessment of our current vaccination infrastructure to determine areas where we need to strengthen or to improve the capacity, that is the physical infrastructure to accommodate COVID-19 vaccines, as well as the human resources needed for the rollout of the vaccine. So far, St. Lucia would have developed a three-phased approach in the rollout of COVID-19 vaccines once it becomes available to the country. You would recognize across the globe that even the developed countries are having challenges accessing and acquiring the amount of vaccine required to offer the level of protection in the country. Hence, what we have recognized is that, as Nurse pointed out, the COVAX facility was established in April 2020 in response to the COVID-19 pandemic. What this facility does, it really accelerates. It's a component of a three-pillar structure. But this COVAX facility really looks at ensuring the availability of diagnostics, that is, materials needed to make the diagnosis of COVID-19, its treatment, and the availability of vaccines. We have known that vaccines take time to be manufactured, to be taken through the various phases of clinical trials before it becomes licensed for widespread use in the population. With COVID-19, we have been seeing the rate of spread and the impact. Hence, we are in the midst of a disaster that is of an infectious nature. And as such, the bodies which incorporates the World Health Organization, France, and the European Commission, they would have put together this COVAX facility to ensure the accelerated intervention as it relates to the manufacture and rollout of COVID-19 vaccines. A lot of us think about the rapidity at which the vaccines have been made available. And so many persons do have their concern. However, it is important to note that the platform on which these vaccines have been produced has been in existence for other reasons. For instance, while we heard of the Pfizer that is being used in the United States and other developed countries, the platform has been there since they were dealing with other infections similar to COVID-19, and that is the SARS. So it's been work in progress. What we have now then is a system whereby all countries need to be safe, and no country is safe until all countries are safe. As we have seen how rapid infectious diseases can cross borders. So this whole COVAX facility is to allow for the equitable distribution of the vaccines so that no one country can vaccinate its entire population while others do not have access to the vaccine. That being said, then this whole COVAX facility was built on persons or countries paying into the facility, and those are, you have some self-financing countries, while you have others, like middle and low income countries, fall into what is called the Advanced Marketing Commitment Group, the AMC group, of which you have some 92 countries, and St. Lucia is a part of that structure. In the early phase of rollout, through the COVAX facility, 3% of the country's requirement will be made available for the vaccination process. So we can do the maths. Look at St. Lucia of approximately 182,000 as our 2020 estimate projects, with a 3% availability of the vaccine in its first rollout. Then there is need for us to then develop a phased approach to allow vaccines to be administered to, one, those who are at high risk of contracting the disease, but also at high risk of transmitting the disease. Also, it looks at those who are at high risk of developing the severe form of the illness. The COVAX facility actually offers some 20%. So by the time you move off from that 3%, we'll be able to expand our vaccination program. So in St. Lucia, we have this phased approach. Phase 1 divided into 1A and 1B, where 1A looks at healthcare workers and or the frontline workers who are in direct contact with or likely to develop COVID-19 by nature of their job. So we have healthcare workers, allied health, police officers, as well as fire officers. But we have that group that we place into that moderate, or before I go that far, 1B, where we have persons who have non-communicable illnesses that are at high risk to develop the severe form of the illness, but also those who are 65 years and older. Has the data has shown us that these persons are likely to develop the severe form of the illness. We do know that at this phase, we also look at certain institutions, such as those elderly caregivers home and there are other institutions that have been incorporated into the plan. But by the time we're going to move off from that 3% to the 20%, which we're likely to have vaccines coming in trenches and not all in one block, that moderate risk group, which we have placed into phase 2, would now incorporate also healthcare workers, fire officers, police officers, we have customs, immigration, that are really not in the front line, and so their risk of exposure is moderate, so we bring them into phase 2. But by the time we go through that phase, and we are now having vaccines in abundance, more than our demand, then we moved into phase 3, which now caters for all those who may not have been covered in phase 1 and phase 2 for whatever reason, and the general population. So we're looking at phase 1 to be about 2 months, phase 2, 2 to 3 months, and phase 3, 4 to 6 months. What we have also looked at in terms of our infrastructure, human resource, to ensure the rollout of the vaccines is to build on our current immunization infrastructure. While the current facilities will be used as vaccination sites, the program is catering for an accelerated immunization program where you have an outreach team or outreach teams developed, 2 teams in the north, 2 teams in the south, comprised mainly of community health nurses, but with the ability to expand to incorporate physicians and other technical staff like those working in the dental community that are versed in vaccination. In addition, this structure gives the opportunity for private physicians and nurses to be incorporated into the vaccination drive. You recognize it's going to be a bit challenging to have persons coming in for the vaccines. And to offset that congestion, what we have done is to establish a pre-registration form. This will be distributed to the various facilities, institutions, but also the general public would have an opportunity to indicate their willingness for vaccination through registration at the wellness centers, where they will set up that platform that would allow you to call in and make your registration known that you're willing to accept the vaccine. I must also say that we also want to know those persons who may not or decline for whatever reason, so that we can manage your expectations and give you the right information so that you can make an informed decision surrounding the COVID-19 vaccines. So we are going to have this appointment system. It is important to note that, as nurse would have pointed out earlier, the vaccines we are seeing thus far requires 2 doses. The AstraZeneca, the Pfizer, the Moderna, that have been approved for emergency use requires 2 doses. As such, what we have done is to roll out a vaccination card. Some of you may have learned of the yellow fever, where you get a certificate upon vaccination so that you can travel to certain territories requiring such. So you will get your card, and it will be of several uses. One, as a reminder after your first dose that you need to return for the second dose. And two, to show that you have been completed in terms of the vaccination process once you've had the 2 doses. And as we move forward, there may be need for us to show a state of vaccination in order to travel, so you have that card ahead of time. So when you get it, please keep it safe as your passport. Moving forward, nurse would have explained the whole concept of immunization being associated with some form of adverse reaction. And we know, for instance, persons who take their child or children for vaccination would recognize that the nurse would tell them, after vaccination, you're likely to see some redness at the injection site. The child may be irritable because of some pain. You may have some swelling, as well as they may develop fever. And this is something that we have learned, we know, and we have prepared to manage. And for this reason, the pharmacosurveillance, or that component of the vaccination program, allows for persons who may develop some form of reaction or adverse reaction to report. And this is very critical. This we have been doing since the rollout of our immunization program. It is already inbuilt. So all we're doing is to add COVID-19 onto that platform. And we've moved to the point where we further strengthen this by integrating the COVID-19 vaccine into our SLUIS system, that is our health information system. So it would allow us to, after your first vaccination, we can look at the schedule and determine those who are due for a particular date, and we can work around planning for those persons and for the incoming candidates. More so, it would alert us if someone would have missed the vaccine. So we have put mechanism in place to ensure that once you would have had your first vaccine, that we know the second is important, and so we have mechanism in place not to miss that. Just to strengthen, as it relates to adverse reaction, the whole COVID-19 vaccination process is ongoing. And as such, in terms of the reporting as to what proportion of those vaccinated are likely to develop some form of a reaction, which could be mild to very severe, which like we have seen in other vaccines in the past, like allergic reaction if you have an allergy to some component of the vaccine. As in some territories like Texas, which I've observed, they were able to show some 0.004% of adverse reactions. And when you look at the benefits as against the risk of COVID-19, having COVID-19 disease, then the benefit of vaccination outweighs the risk of not doing so. What is important for us at the Ministry of Health and within the health sector to really get the pulse of the community, of the people in the health sector, as well as the public, as to your thought of the whole COVID-19, so that this information will allow us to tailor our message to better reach you and also to help in the rollout of our program. And as such, in the near future, within hours to days, you are likely to receive on your mobile platform a survey that really asks you some questions. And I want you to take the opportunity to go through the survey and be honest with your opinion, not opinion, but the way you think about the questions. Be honest with it, because it's going to help us to help you. And you're going to help, you will be helping us also, so it's a two-way. So I encourage you to take the survey. We will not be knowing who is saying what. All we want to have is the general information that we can use to help the general population. The vaccine will be free, and it will be done on a voluntary basis. But while it's going to be done on a voluntary basis, we would like you to be informed when you make your decision. Some persons may think, okay, I have received the vaccine, so it's time for me to drop the mask, stop social or physical distancing, and move away from the hand sanitizer and adequate hand hygiene. I want to let you know, it is very important after your first shot, even after your second shot, to continue the strong and effective public health measures that the Ministry of Health and Wellness, in conjunction with other stakeholders, would have put together thus far. We have seen that when we adhere to those protocols, we keep COVID-19 at bay, at a minimum. But once we step away from those protocols, we are now seeing the likely impact. I say this to really emphasize that after your first vaccination, like all vaccines, you're not totally protected immediately, because the body takes some time before it produces, nurse mentioned those defense mechanisms like antibodies, to be produced. And even after your first shot, what they have shown, AstraZeneca, Moderna, Pfizer, you need that second shot to boost your response. And at that point, for the Pfizer and the Moderna, it brings you to about 95% protection, so that if 100 persons were vaccinated, 5 are still likely to develop an infection with symptoms. For the AstraZeneca, they've started off at 70, but now it's been increased up to in the 80% range. So it is important that while we receive our vaccines, we continue the public health measures. More so, it is important for most of St. Lucians, persons residing in St. Lucia, to have the vaccine, because if 1 or 2 persons receive the vaccine, the impact will not be measurable or effective. We need to have over 80% of persons showing up, being vaccinated, and the greater the number of persons vaccinated, the more protected we are. We need to continue still even at that level of coverage, because if the rest of the world does not attain that level of coverage, then persons are still likely to come to St. Lucia with COVID-19, and how small it is, that 5% or what number that are likely to become infected can become infected. So, vaccine is safe, it has saved lives, and it will continue to save life. At this point, I hand you over to the chair, and we open for any discussions.
Thank you very much, Dr. Joseph. Before we start into the question segments, if you can reiterate, where can persons actually get access of the CAP survey?
This will be rolled out on your mobile platform as a mechanism by which we can reach the general population and healthcare workers. It should be out the soonest, and as I said, you look out for that.
Thank you. The first question we have is from Nelsha Shalmine from Choice TV. The question is, several European countries like Sweden and Poland have decided not to give the AstraZeneca vaccine to people 65 years and older, as there are worries of it being efficient in that age group. Will St. Lucia move along with vaccinating that age group first?
It's a very good question. And one of the things you're going to recognize is that that's a decision made within a certain segment of the globe. So far, it's not a global position, but within those European territories. In the initial recommendations for the rollout of the vaccines, persons aged 65 and older were targeted because of, one, yes, the risk of contracting the disease, COVID-19, but also the risk of them having the more severe form of the disease with fatality. What we have seen so far with the information coming out of the various trials is that they have utilized persons who are healthy, young, vibrant, and when I say young, for the AstraZeneca, they did not use persons under the age of 18. Likewise, the elderly, 65 and older. Just to expand, for the Pfizer, again, they have used strong, healthy persons, generally, no one under age 16, nor the pregnant women. As such, they really do not have information or the evidence as to the efficacy of the vaccines in this or these populations. And yes, I know those territories would have had the reservations. However, globally, according to recommendations coming out of the World Health Organization and other bodies, we will continue with those recommendations until the science dictates any different.
Thank you very much. And that leads to the next question from Janica Simon from the Virgin Island Consortium. The question is, does St. Lucia currently have any plans to acquire vaccines on the open markets outside the COVAX facility? And if so, when would those be expected to arrive in St. Lucia?
Nurse?
Thank you, Ms. Neptune, sorry for this question. St. Lucia will continue to rely on the World Health Organization pre-qualifications, and the reason for this is to ensure that vaccines we receive, vaccines being offered to our citizenry, is safe, it's efficacious, and it's of good quality. St. Lucia is accessing its first set of vaccines through the COVAX facility, And of course, this is just going to cover the first 20% of our population. That being said, there is the need to procure vaccines to cover the remaining 80% of the population. In history, and as a matter of fact, St. Lucia continues to procure vaccines through the Pan American Health Organization, the revolving fund, and will continue to do so. However, there are other platforms that are available where vaccines can be accessed. Whichever platform that St. Lucia decides to access vaccines through has to be one that is credible, has to be one that is recognized, that its processes are legitimate. And as long as the vaccine that is being offered through the platform has gone through the necessary processes, regulatory processes, and it is pre-qualified for use by the Pan American Health Organization and the World Health Organization by extension, St. Lucia can and is willing to engage other suppliers, but we will not be engaging anybody on the open market for vaccines.
Thank you. And perhaps you can tell us who will be exempted from the vaccine at this point in time for the rollout?
Well, the vaccine is going to be offered to persons 16 years and older, and Dr. Joseph would have alluded to that in his presentation earlier. Of course, anybody that would have had some pre-existing condition that contraindicates, where vaccines are contraindicated, of course they would be exempted. But out of that, the vaccine is safe and is going to be offered to anybody within that age range.
Wonderful.
If I may, can I?
Sure.
Just to support what Nurse has said. When you think of who may be excluded or may not qualify for the vaccine in the early phase or phases of the rollout, first of all, we need to think as to which of the vaccines we're talking about. You're going to recognize that while St. Lucia is preparing for the incorporation of a certain type of vaccines in terms of the storage temperature into St. Lucia, we are building capacity to have both vaccines that are stored at 2 to 8 degrees, which is currently our storage temperature for our current vaccines. But also, if you think of the Pfizer, that requires an ultra-cold storage of some minus 70 degrees, of which we are building our capacity for such. Now, it depends on which of the vaccine you're going to be administering. So far, for the Pfizer, you have, Nurse already indicated, those younger than 16 will not be qualified at this point because they don't have the data, they have not done the clinical trials in that age group. And pregnant women, so far they have not done, that is, enrolled pregnant women into the clinical trials. However, what they have observed thus far is that while in the clinical trial, some women became pregnant. And as such, they have not reported any adverse events on the female or the pregnancy. So while for the Pfizer, it said that those under 16 and the pregnant women are not in line for the vaccine, by the same token, if it's been recommended through the CDC, if the pregnant woman would like to have the vaccine, they're likely you can administer. When you think of the Moderna, they have been looking at 18 years and older, and again, pregnancy excluded. And for the AstraZeneca, they're looking at 18 years and younger being excluded, and they did not say much of pregnancies. So what we are seeing is that while you have generally children are excluded, depending on the vaccine, the cutoff point in terms of the age varies slightly. And in terms of pregnancy, generally there is no data. However, for the Pfizer, the Moderna has been recommended that if they would like to have it, yes, they can have it.
Okay. And would that mean that persons who've had COVID can actually get the vaccine? And if yes, how long after can they actually get this vaccine?
To date, the recommendations are that if someone would have been infected with COVID-19, they can or should still have the vaccine. We have learned from our immunization programs that when you become infected with an illness that is a vaccine preventable illness, then you're going to produce those memory cells, antibodies that are going to be there to recognize the infection in the future and fight off the virus. It's going to act like a natural immunity, like a vaccine, but just that you've had the infection. Put it in simple terms. Remember, COVID-19 is evolving, and as such, how long the immunity lasts after a natural infection is not clear. Some studies may have shown that there is waning of the antibodies produced, and as such, they have recommended that even after a COVID-19 infection and you would have recovered, you can have the vaccine. The thing is, how long after? And they're looking at some 90 days or so after you would have had the infection and recovered, then you can have the vaccine.
Thank you. We have another question from Riani Isidore from MBC Prime. The question is, does the 74,000 Oxford or AstraZeneca vaccines earmarked for St. Lucia include the second dosage as well?
That's a very good question. And it gives me the opportunity to explain one component of the plan that we did not highlight. Since the vaccines, or since each person requires 2 doses, it means that if you have 74,000, you practically have to divide it in 2, administer to your high-risk groups, and reserve the remaining doses for that group or those groups. If you're going to say you have 74,000 doses of the vaccine, and I'm going to vaccinate right off the bat 74,000 persons, then at the end of that 74,000, nobody really will be protected against COVID-19 because they would have all had a single dose that brings you up to about 60% of the level of protection, and you need that second dose. So in all our planning, our total doses must be divided, and that's the number we are going to cater to until we can build the capacity with more doses.
And the reason, just to add to what Dr. Joseph said, the reason for this is that the second dose of the vaccine must be of the same manufacturer, the same type of vaccine. So I can't receive one dose, a first dose in one vaccine and get a second dose in another vaccine. That does not ensure me protection. So hence the reason why it's important that the first dose and the second dose must be of the same. And as such, the 74,000 doses is for the 2 doses. So in actuality, it's really to cover 47,000. Yeah, thereabout.
Okay. Great. Question from Nelja from Choice TV. Any plans to obtain vaccines from Cuba, given that St. Lucia has a friendly medical relationship with this country?
To date, the opportunity exists. I mean, the offer has been made, but the Ministry of Health at this point have not made a decision as to whether or not we will accept the offer. But if the vaccine, remember earlier I mentioned how important it is for vaccines that we offer to our population to have undergone the required regulatory process. As long as the vaccines offered from Cuba has gone through the required regulatory process and is pre-qualified by the World Health Organization for use in our population, then of course it's an option. But until then, no, we would not engage, and as I said, a decision has not been taken in that regard.
If I may, thank you. St. Lucia acknowledges the generous gesture of the many countries that offer support in this regard. St. Lucia has been helped in so many ways over the period of time by Cuba and other countries. And what these nations are doing is recognizing they're having the ability to produce certain required medical supplies, extending their support for St. Lucia. As you recognize, Cuba has been supporting St. Lucia in the fight against COVID-19 with some 113 plus medical brigade who came to St. Lucia just to support our response. While we do acknowledge that there are regulatory framework that governs the introduction and or incorporation of certain pharmaceuticals into the population, we do acknowledge and welcome the gesture. Through this vein, we will continue to do due diligence to ensure that vaccines, irrespective of the territory of origin, is appropriate for St. Lucia. So we do acknowledge and we do say thank you to Cuba's gesture.
So I'm guessing this piggybacks on the question from Riani, because Riani was asking how much would it cost to procure additional vaccines outside of St. Lucia's COVAX allocation?
The cost of vaccination varies, or the cost of per dose of vaccine varies. It depends on the platform you're accessing the vaccine, and in addition to the actual cost of the vaccine dose, you need to think of in terms of freight, transportation, and clearance. So far, we have seen a wide range from as low as about $2-3
yeah,
to as much as 35 US dollars. But we have been working with an average, well, it's not technically an average, but a cost of about $10.55 per dose, knowing that this can likely be more or it can be less depending on where you're accessing the vaccine. So do the math. St. Lucia's population of approximately 182,000. 16 years and over accounts for some 80.6% of the population. That brings you to approximately 164 plus thousand, round it off to 150,000. So you're looking at 150,000, 300,000 doses to vaccinate that population. Multiply by 10.55, you recognize we're looking at some 3-point-something million US dollars. It's very costly. And health, of course, overrides the cost. And as such, we are putting everything into it to ensure that St. Lucia is safe. What we look forward for is your buy-in to the program and for you to sign up and become one of those who say, I have been vaccinated against COVID. Think about your elderly at home. Think about your family members who may be having some form of chronic illness. Hence, each one of us is going to contribute towards protecting each other. And for me to emphasize that many persons are of the concept that, okay, I may not have a chronic non-communicable disease. I may not be 65 years and older. But one thing I want you to know is that in those developed countries with all the resources, they have seen persons who do not have any of those, well, healthy, no underlying illness, and which we have seen in our own St. Lucia, can succumb to COVID-19. It's just that if 10 persons get or become infected with the virus, we all are going to respond differently. Some may very well fight it off, do not show symptoms, but yet you go out transmitting the virus. Some may have a mild illness, some may have the severe form of the illness, and we have seen that some may succumb with their life ultimately. So, to note, we all are at risk whether you have underlying condition or underlying illness or not. Hence, we all need to implement or practice hand washing frequently, practice physical distancing. I know many persons, while you have the protocols limiting the number that can congregate, we tend to say that, okay, we're not going to do it from a public perspective, but we're going to have a little gathering in our homes. But guess what? When you have all the small pockets in your home with your gathering, then they leave and go to their homes, and if they pick it up from your home, then they're taking it to their home and other gatherings that they go to. And ultimately, we have this multiplying effect. So it is important for us really to adhere to the protocols to save life. Thanks.
Thank you. Before we take our final question, when is it expected that the first phase of the vaccine will be rolled out?
Nurse?
Well, St. Lucia has received confirmation of the vaccine, and based on our timelines for arrival into St. Lucia, we have been informed that it's by the end of February. However, we know the process involved shipping and all the logistics, and of course with the effects of COVID-19, I mean shipping and delays and all of this. So we are giving some allowance for the vaccine to get there, just in case we do not meet our end of February timeline. We're hoping that the vaccine should get here sometime by the mid-March, sometime in the late first quarter. Once the vaccine gets here, we're hoping that all logistics in country would be in place, and to roll out the vaccine introduction as soon as vaccines get here. So that being said, we're being optimistic and hoping that the vaccines will be here by end of the first quarter, by March, and so we could roll out.
Thank you. Before we come to a close, we have a final question from Janika Simon and Riani Isidore. Recent preliminary data suggests that the AstraZeneca vaccine, which we'll be receiving as part of COVAX, may not be effective against the South African variant of COVID-19. How might the vaccination process be affected by the most resistant strains of COVID-19?
That's a very good question. And I know many persons beyond the one may be wanting to ask that very question. And I must say, to date, the strains that have been identified, or let me rephrase it, the vaccines produced so far are effective against all the strains identified thus far. We know that persons are going to look towards the influenza vaccine, whereby due to changes in the genetic composition, minor changes which we call mutation, the vaccine may not be as effective, and as such they have to update on an annual basis. We need to understand that the COVID-19 vaccines really have been approved for emergency use because we are in the midst of an infectious disaster, and it's going to take time for us to really understand the full magnitude as to how long-lasting the immunity is. But what they have done so far, I must say that there are certain trials presently as it surrounds the AstraZeneca, where persons are being tested on a weekly basis to determine whether the immune system is sustaining the antibody or it is dropping. And also, they are testing persons to determine whether they have contracted the virus after vaccination. So that is ongoing. But to date, I haven't seen any evidence that supports, and I will continue looking for such. Thank you.
Thank you. And before we close, if you can make an appeal to St. Lucians as it relates to the COVID-19 vaccine quickly.
Okay, at this point, I just want to say that we know many of us, we are waiting for the opportunity to receive the COVID-19 vaccine. Of course, some of us still have our doubts. Some of us are still watching to see what's happening in order for us to make a decision. Understandably so. I mean, we are being bombarded by the media. We see lots of negative remarks as it relates to vaccine, not just the COVID-19 vaccine, but vaccines in general. But I just want to assure St. Lucians that vaccines that we procure and we make available to our population is safe, it's effective, and of good quality. Approved COVID vaccines thus far have gone through rigorous trials, and safety of vaccines is our top priority and our concern, especially as it relates to our population and the people receiving the vaccines. This is our main concern. So I just want to assure us that, and just want to encourage St. Lucians to embrace the vaccine when it gets there. It is a vaccine, the COVID-19 vaccine, like any other vaccine in our program, is a public health strategy to help contain infectious diseases, outbreaks, and of course, to help achieve immunity and to bring some sort of control to the disease. We've seen vaccines work, and as I would have said at the beginning of the program, it is due to vaccines that we do not see vaccine preventable diseases in our population. Many of us, many people of my age, and even some a little older than I am, would not have even seen a case of a vaccine preventable disease. Why this is so? It is just because of the successes of the immunization program. It is because of the successes of the immunization and the successes of vaccines and the benefits, of course, that it has to our people, to our citizenry. I just want to take this opportunity to let our people know that we're still in the flu season. Yes, the focus is on COVID-19, but we're still in the flu season, and we know the effects of influenza can be just as life-threatening as COVID-19. We know the symptoms are similar, and at-risk populations and our frontline workers, we just want to encourage you to access our facilities to get immunized against seasonal influenza. Before I close, I just want to emphasize a point that Dr. Joseph would have made earlier, that no vaccine actually provides you with you don't get the immediate effect of a vaccine right away. But it is important, that's why it is important that even if you would have received the vaccine, you would have received the first dose of the vaccine, or even if you would have received your complete 2 doses of the vaccine when it gets there, it is important that we continue to adhere to the protocols, continue our social distancing, continue wearing our masks, and practicing infection prevention and control measures. It is very important to do so because we have seen cases of reinfection, and of course, as we know, research is still going on as to how long, immunity that would have been incurred if somebody got infected with COVID-19, how long that will last. So hence the reason why the vaccine is very important to ensure that you have that level of protection that you would need. Dr. Joseph, any final words?
Thank you, Nurse Baptiste. I think it was well said, but just to end on the same point that you have closed on, just to reiterate the importance of us continuing our public health measures is that the vaccines have been shown to be effective the Pfizer, some 95% on the 2 doses, less than for the first dose, and that's why you need to go for the second. Likewise, the Moderna and the AstraZeneca. So what we are trying to emphasize that once you get the first dose, do not drop your guards. And even after the second dose, continue washing your hands, physical distancing, use your mask, among the other public health measures. And if we all can practice these simple, very cost-effective measures, in addition to taking the vaccines, we will be able to bring St. Lucia back to its economic glory. Thank you. On behalf of the Ministry of Health and Wellness, we would like to encourage you to take the survey. It's going to be out the soonest. Look for it, be anxious, and hit us with your thoughts. We will use everything you say, and it means at the end of the day, once you provide us with those feedback, is that you're actually a part of the process, because your idea, your thought has been counted. And so the ministry look forward for your continued support in every aspect of the COVID-19 response. Thank you.
Thank you very much. Well, we have come to the end of the press conference on the COVID-19 vaccine. Of course, we want to thank Dr. Glensford Joseph and Nurse Tecla Baptiste for being part of the panel and providing us with information on the vaccine. Thank you. On behalf of the entire production team, I am Fernell Neptune. Thanks for watching.